Ain't nothing better than watching you smile. Whoa, whoa, whoa. Ain't nothing better than watching you laugh out loud, my baby. Ain't nothing
Masters
better.
live from the Boomer Summit 2014 in San Diego, California. It's my privilege to chat with Rob McCray, the president and CEO of the Wireless Life Sciences Alliance, also known as WLSA. So, Rob, welcome to the Boomer Summit.
Well, thank you very much. It's great to be here with our customers.
And now tell me, what brought you here today?
Well, you know, we were invited to come over, and the Boomers represent the social change, the customers that are going to drive change in personal health and in institutional health care. So I was very pleased to come, give a keynote conversation, and bring some of our members.
So you're someone who's in a good position to evaluate that. What are you seeing?
In terms of boomers, we're already connected, right? We've got wealth compared to the rest of our generations. We're facing a life where we're caregivers, and at the same time, some of us are getting to places where we have more personal health problems, things that go with aging. And we are open to embrace new approaches to managing our own health care. And that's what my community of companies and thought leaders and researchers and scientists are creating.
That being WLSA?
That being WLSA, exactly.
Tell us a little bit about WLSA.
So we're a nonprofit trade association. We were created in 2005 to bring together the healthcare and technology sectors. 9 years later, we're an international association, still quite small by those standards, about 80 organizational members, but they are all committed to change, all committed to creating tools for personal health and for the better management of healthcare problems. It is not a healthcare dominated association.
And you happen to be located here in this beautiful city of San Diego, eh?
Yeah, my co-founder Don Jones and I happened to be here when we started it, so that's where headquarters is.
So I chatted with Don earlier today, but give me some sense of, I know you're here delivering a message, but what have you seen here that's caught your fancy?
Well, you know, there's a strong interest in what we're doing, and it was good to see AARP focusing on accelerating investment in health solutions based on they're trying to bring everyone attention to the buying power of the boomer generation, the 50-plus generation. In our sessions, there were very, very intelligent questions from all types of people and organizations about our space, as we showed what is coming in the future or what is in the market that maybe you haven't heard of yet. So that's really heartening, and it reinforces my belief that we're going to be a generation that changes healthcare just like we have changed other sectors of the economy.
So are you encouraged by what you're seeing? And let me qualify that by saying, there's lots of innovation going on, quote unquote, but there's rather slow uptake out there, particularly on the provider side. Are you encouraged by what you're seeing, that this may maybe get framed through the eyes of the boomer and maybe accelerate the uptake in the market?
So, obviously I look for encouraging signs, but change is always very, very slow to happen, and then it happens and everybody thinks, well, that was quick. But of course, major changes always take some decades to happen. And health and healthcare are no difference. What I'm seeing is that some consumer brands and food brands that promote healthier eating, healthier lifestyles are gaining an advantage in the market. They have higher margins, they have better growth than the traditional companies. That's a really powerful sign that consumers in general, are paying more attention to their health. If you look at the sort of phenomenon of health and wellness apps and activity meters, that basically didn't exist 5 years ago. Now there are hundreds and thousands of these apps, probably hundreds of these devices, and there is a broad awareness that movement is good. That's what that, to me, that indicates an awareness in the consumer mind that movement is good. Does it lead directly to change? No, but it sets the kind of the ground for the customer uptake of more advanced tools.
Do you see a shakeout coming anytime soon?
Oh, that'll just be continuous, sure, absolutely. We'll reach a crescendo. Someone mentioned kind of the trade shows and meetings around digital and wireless and connected and electronic health, which have gone from just a handful to hundreds, and that'll come back down to some normal level. But what will really happen is that connectivity and connected health solutions will just be embedded in the larger economy, and then we'll move on and we'll deal with some other issues.
So some say healthcare is maybe 10, maybe more years behind general industry in adopting new tech. What accounts for that?
Oh, it's a variety of reasons. The business models, the payment models for healthcare have not, by and large, demanded information about outcomes or quality. They've been based on volume. How many services do you provide? Your compensation model kind of sets the tone for what you get. And so if you pay for volume, you're going to get volume. If you pay for quality, you'll get quality. So we're switching over time to quality-oriented, outcomes-oriented payment systems. That will change everything. Another one is, think of it, it's a trade model that was created hundreds of years ago, where professions regulate themselves. They define the rules at the state level and society level for what they can do, what's quality, and they govern themselves. Not a transparent approach. It's sort of the opposite of a consumer-oriented approach, where everything you do is sort of transparently open to the public, and if it doesn't work, you can't make a sale and somebody else steps in. So there's a number of big factors as to why it takes longer.
So as you look at some of the macro changes, particularly inside the financing and the delivery sector, with the ramp up of accountable care organizations and patient-centered medical homes and population health management, care management, all that, do you see that accelerating the adoption of some of these technologies to the point that we can actually achieve the triple aim?
I think we can do better than the triple aim, actually. I think we can put the power back in the hands of individuals, and we can give them the tools so that they can take more responsibility for their own health and their own health care when they need it, and create an environment where the institutions that deliver services are held accountable to patients for both the cost and the outcomes of their service. Both of those are missing today.
And you think, it sounds to me like you think the consumer-directed health plans or the high-deductible health plans with more, quote, skin in the game on the consumer side is one of the incentives creating that awareness?
Yeah, I mean, that's just one particular insurance model, but more people in individually purchased health insurance plans is part of that trend. Much greater out-of-pocket requirements. I mean, we're over $1,000 per capita in this country for annual healthcare expenditures already. That's a lot of money. That's $300 billion a year already, and it's going up. So all those financial trends are making individuals more responsible and more aware, and of what they're spending. The tools of transparency are also helping them become aware of how dysfunctional healthcare pricing is, how irrational it is, and also aware of kind of the dangers of traditional healthcare. Hospitals are not safe places to be.
Right, and that transparency thing is raising the level of awareness, obviously, and the concern about how to be better informed and to mitigate one's risks in terms of interacting with the system.
Yeah, I mean, I think mitigating risks, if you will, that's where the culture change, and we've already done it. We have some real success factors here in the United States. If you think about lung cancer and smoking, primary cause of lung cancer is smoking. It's a voluntary activity. It's not necessary for anyone. It's addictive, and we've cut our smoking rate in this country from over 50% to under 20% over the last 40 years. Well, the lung cancer rate is going down with that. Same thing with, look at seatbelts. Cars weren't equipped with them until, In the 70s, now 85% of us, 75% of us put them on every time we get in a car. They save lives. Drunk driving, impaired driving, drunk driving used to be socially acceptable. It's not. That's 25 years. Those all save lives. They save healthcare costs, if you want to put it in economic terms, but they save lives. They're a result of cultural behavior change. So as we embrace just healthier lifestyles, healthier foods, because they're the cultural norm, not because they're what I'm supposed to do, then we end up with lower demand on healthcare, healthier, more productive citizens, and tremendous savings on unnecessary, avoidable healthcare costs that can be devoted to other purposes.
Great. Well, thanks for that, Rob. Let's circle back and talk just to close here about WLSA. I understand you have an event coming up. When and where?
So the event's May 14 to the 16th here in San Diego at the Omni. It's our 9th Convergence Summit, where we bring together 275 committed people and organizations from around the world to share concepts, share ideas, and find business partners to go develop connected health solutions for health and healthcare problems.
In closing here, Rob, tell me about, again, what is the mission of WLSA?
So we started with the mission to accelerate convergence of healthcare and technology, because 10 to 15 years ago when we began to work on it, that wasn't happening. Now it is. And our mission, we've shifted, we've changed our goals. Our goals are to drive consumer adoption of personal health and tech-enabled solutions for managing health and healthcare at the personal level, and to drive institutional adoption of these better solutions for healthcare that will improve the quality and improve the outcomes and efficiency of their processes.
Well, from one boomer to another, Rob, thanks for stopping by today.
It's my pleasure. Good to see you.
Ain't nothing better than watching you smile. Whoa, whoa, whoa. Ain't nothing better than watching you laugh out loud, my baby. Ain't nothing better than watching you be you. Ain't nothing better than right now.